Hey guys, this is FixerMed. Welcome back to my ECG Skills Builder Workshop, where I'll be covering all the fundamental knowledge and skills you'll need to read and interpret an ECG in a quick and effective manner. This will be part 8 of my multi-part video series of doing so. So without further delay, let's go ahead and get started on today's content. So today I'll mainly be focusing on the ST segment, and I'd like to give you some background information on it. The end of ventricular depolarization and the beginning of ventricular repolarization denotes the ST segment. The point marking the end of the QRS complex and the beginning of the ST segment is known as the J point. Changes in the ST segment, such as elevation or depression, may indicate myocardial damage or ischemia. I have a nice picture to the right to depict a normal isoelectric ST segment and what ST segment elevation is and what ST segment depression is. We'll be going through this in more detail in the upcoming slides. Moving on. So some characteristics about ST segments. The location of the ST segment is typically from the end of the S wave to the beginning of the T wave. Amplitude is usually isoelectric. If elevated, it's more than 0.1 millivolts. Duration typically ranges from 0.08 to 0.12 seconds. Configuration, it's normally flat or isoelectric, but it also may be elevated or depressed if significant myocardial injury or ischemia is present. The deflection is typically isoelectric, but may be elevated or depressed in the presence of myocardial injury or ischemia as stated before. Moving on, let's go ahead and talk about some variations of the ST segment. The elevation indicates myocardial injury. Depression suggests myocardial injury or ischemia. So elevation is typically just myocardial injury, while depression can be either or. Changes, it's associated with conditions such as pericarditis, myocarditis, left ventricular hypertrophy, pulmonary embolism, electrolyte disturbances, and antiarrhythmic drug use, like amiodarone. All right, that will do it for content today. Let's go ahead and test our knowledge with some questions. What cardiac condition is most likely indicated by ST segment elevation on an electrocardiogram? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. ST segment elevation on an ECG is typically indicative of myocardial injury. Among the options provided, pericarditis is the most likely condition associated with ST segment elevation. Pericarditis, inflammation of the pericardium, can lead to ST segment elevation and multiple leads on an ECG, often with concave upward morphology. This elevation is typically widespread and not confined to specific coronary artery distributions. Therefore, the correct answer is A, pericarditis. Let's go ahead and see why the other answer choices are incorrect. Atrial fibrillation. Atrial fibrillation is characterized by irregular rhythm with no consistent P waves and does not typically cause ST segment elevation on an ECG. Hypertrophic cardiomyopathy. While hypertrophic cardiomyopathy can lead to various ECG abnormalities, such as left ventricular hypertrophy and T wave changes, ST segment elevation is not a typical finding. Pulmonary embolism. Pulmonary embolism can cause right ventricular strain patterns on an ECG, such as S1Q3T3 pattern, but it does not typically present with isolated ST segment elevation. Sick sinus syndrome. Sick sinus syndrome may result in bradycardia, tachycardia, or bradycardia, tachycardia syndrome. on an ECG, but it does not typically cause ST segment elevation. All right, let's go ahead and move on to the next question. Which condition is most likely associated with ST segment depression on an electrocardiogram? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. ST segment depression on an ECG is often indicative of myocardial ischemia. Among the options provided, myocardial infarction is the most likely condition associated with ST segment depression. In myocardial infarction, there is inadequate blood supply to the myocardium, leading to ischemia, which can manifest as ST segment depression on the ECG. This depression is typically seen in leads facing the ischemic area and may be associated with T wave inversion. Therefore, the correct answer is A, myocardial infarction. Let's go ahead and see why the other answer choices are incorrect. Hypertrophic cardiomyopathy. While hypertrophic cardiomyopathy can lead to various ECG abnormalities, such as left ventricular hypertrophy and T wave changes, ST segment depression is not a typical finding. Atrial fibrillation. Atrial fibrillation is characterized by irregular rhythm with no consistent P waves and does not typically cause ST segment depression on an ECG. Pericarditis. Pericarditis may lead to ST segment elevation on an ECG rather than depression. Pulmonary embolism. Pulmonary embolism can cause right ventricular strain patterns on an ECG, such as S1Q3T3 pattern, but it does not typically present with isolated ST segment depression. Moving on, let's go ahead and take a look at the next question. Which of the following conditions is most likely to cause ST segment elevation on an electrocardiogram? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. ST segment elevation on an ECG is often indicative of myocardial injury or ischemia. Among the options provided, ventricular tachycardia is the most likely condition associated with ST segment elevation. Ventricular tachycardia can lead to myocardial ischemia due to inadequate coronary perfusion during rapid ventricular rates, resulting in ST segment elevation on the ECG. This elevation may be widespread or localized to specific leads depending on the affected myocardial territory. Therefore, the correct answer is E, ventricular tachycardia. Let's go ahead and take a look at why the other answer choices are incorrect. Bradycardia. Bradycardia is a slow heart rate, is not typically associated with ST segment elevation on an ECG. Atrial flutter. Atrial flutter may present with characteristic sawtooth P waves and regular atrial activity, but it does not typically cause ST segment elevation. Hyperkalemia. Hyperkalemia may lead to characteristic ECG changes such as peak T waves and widened QRS complexes, but ST segment elevation is not a typical finding. Bundle branch block. Bundle branch block may cause widened QRS complexes on an ECG, but it does not typically cause ST segment elevation. Guys, that will do it all for the content today. If you guys have any questions, comments, or concerns, please feel free to write them down in the comment section below. If you like this type of video, be sure to leave a like and subscribe for more content like this. plan to go into greater and greater detail about the ECG, so stay tuned for new parts for this series. They should be coming out daily moving forward if I have time. If not, I'll try to do it as often as I can. But that's all I have for today. This is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying, and goodbye.